Welcome to my world. Another day, another time for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with infertility test and pregnancy, with focus on AMH. AMH is anti-Mullerian hormone. When you talk of infertility, you are more or less talking about a problem with the gonads. We have two gonads, whether for male gonads or female gonad. The male gonad is more involved in the testosterone production, while the female is for estrogen and progesterone. But it never ends there. There are other surrounding factors that could cause infertility. But the concern and interest I shall be dwelling much upon is the female infertility test and focusing on AMH, anti-Mullerian hormone test. You may think that when you have done all the infertility tests and you are found to be okay, that then you can be pregnant. Well, it is not always true, but at least 90% and above, the probability of being pregnant is very high, and that is all the assurances that the medical laboratory scientists can give, or even your gynecologist or clinician can give you. So if you like my production, my video channels, please press the like button, subscribe, and more quality production will come your way. Let's start with the outline. We have the objective introduction fertility test, which I term infertility test because we are trying to look whether the person is infertile. Lab diagnosis, AMH test, and conclusion. Objective: to create the awareness of anti-Mullerian hormone tests as one of the most important female fertility tests, which I classify as infertility tests in order to reduce the anxiety of childless couples. Introduction. Infertility is a problem of childless couples who have been married for years and they continue copulating without success. The problem are usually caused by the quality of their gonad products, testes in male or ovary in female, and both are paired. At times, it may be there. Physically, you see these gonads, but there is either an ovulation or the semen contains no sperm cell. These organs are responsible for producing the sperm and ova, but they also secrete hormones and are considered to be endocrine glands. The gonadotrophic releasing hormone controls their hormonal production. It is located in the hypothalamus. Continuing. The main causes of infertility in women were anovulation, 21%, tubal damage, 14%, and endometriosis, 6%, while 28% of cases were unexplained. And that is the finding of one population study by Hull, MG, and his co-workers. Infertility test in male is usually centered around semen analysis quality and the pathophysiology of the problem. Many hormonal tests are done, from gonadotrophic releasing hormone, testosterone, estrogen, progesterone, etc., and of recent AMH. AMH plays a key role in developing a baby's sex organ while in the womb. AMH levels are higher in males, as this prevents them from developing female reproductive organs. So the female babies only need a small amount of AMH for their development until puberty, when the AMH is at the highest level, and it will now gradually come down until when it's menopause around 40 years or 50 years that you now do not see it. So the AMH is very useful to measure the fertility test. That is, if a woman has infertility problem. In women, cells inside the follicle of the ovaries produce AMH used for fertility test. Yes, this to the right is the uterus, the shape, you can see it. And that circle shows the ovary. The ovary, if you look at the inside, there is that hormonal secretion from the follicle, the AMH, as the follicular growth indicates. Then there is ovulation, when the egg is really coming out. This is a sign that the menstrual cycle. Now let's look at the ovary itself. If you look at the top corner, the top label area, you will see the primordial follicle. Is that follicle that becomes the primary follicle that turns to the oocytes. The follicle are secondary, and these are the follicle that produces the anti-Mullerian hormone. So as it is growing, it produces that anti-Mullerian hormone that tells you the number of egg in it that can come out from the production. You can now see the Graphian follicles, which grows to produce the egg, and that's the period of ovulation. The remaining develops the corpus luteums, and the corpus luteums continue to produce the progesterone hormone too that is tested. But once there is no implantation, that is, if there is no fertilization, the whole process is controlled, and the corpus luteum degenerates. That ends that cycle. Now let's talk about fertility tests. These are all tests that can be done in the laboratory. The AMH is number one there. You have the pregnancy test, ACG, the DHEA. All these are tests that could even dihydrotestosterone. You have the progesterone, you have the prolactin test, and all of them are very useful to really tell us how fertile the woman could be. And if there is any missing hormone, there is surely a way of correcting it. Yes, this is WHO presentation pie chart showing the female infertility causes. The first part you will see unusual problem as 10%, tubal and pelvic pathology colored purple is 40%. The blue color is representing ovulatory dysfunction, 40%, which you can consider as an ovulation, the hormonal problems. And then the unexplained infertility, that is the one that is also 10%. Yeah, let's look at the ovulation dysfunction problem. When you look at this graph, you will see it's showing the menstrual cycle. The menstrual cycle at the bottom is the days of the cycle. Then when you start, you see the follicle that will produce the anti-Mullerian hormone and all these other hormone listed. So as it grows, as the day goes by, you will see the follicle producing stimulating hormone, the follicle stimulating hormone, the estrogen. And when you look at the estrogen, it's now gradually going up. Well, by the time the egg is mature, the estrogen is high. By the time of ovulation, you find it is the luteinizing hormone that is covering that area, and the egg is now in circulation. The estrogen will come down, whereas at the end of the period of ovulation, that 3 to 4 days, you will now see the rise of the progesterone, trying to make sure the corpus luteum continues to create that endometrium that will be very, very suitable to handle the baby, the fetus. In a nutshell, the menstrual cycle is divided into 3 phases. The first phase is the follicular phase. Then the second phase is the ovulation phase. And the last phase is the luteal phase. The laboratory diagnosis. Several blood marker tests may be necessary to be done as earlier listed, but most common for female fertility tests are the 3 days follicle stimulating hormone, 3-day, 3rd-day estrogen, 3rd-day estradiol, astral follicle count, etc. are indicators of ovarian function. So it is safe to group them as ovarian function tests. Anti-Mullerian hormone test. AMH serves as the earliest indicator of ovarian function, and it can help predict patients' response to hormonal treatment. So it is a test that if it's very low, you can talk of an infertility situation, and probably could be corrected. At puberty, the value is highest and comes down with age until menopause. However, it cannot predict a successful pregnancy because of other factors like the husband or the partner, seminalisis, and the mucus, and probably the antibody against the partner's problem, sperm cells, including lifestyle. Women below 35 years of age should show normal values like 1.5 nanogram to 4 nanogram per mil, and anything below that is considered low, and if it's above 4, at times it could be suspecting ovarian cysts. Yeah, the conclusion from this exposition: female infertility is common and could be approximately 22.3% of married women with problems in achieving pregnancy or in carrying a pregnancy to term. When you're talking of carrying pregnancy to term, you could talk of the pelvic problem, where there is pelvic inflammation and other chlamydia and gonorrhea problems blocking the tube. So the problem will not allow any pregnancy to hold. And there could also harbor viruses. The AMH exposition done here is to tackle hormone imbalance that could be classified as anovulation or ovulation dysfunction, which could be corrected in fertility clinic that correct hormone imbalances in patients. Age, however, is a factor in decision making as earlier exposed. So a person who is of over 40 years could, I don't know, science is progressing anyway. So it is advisable that fertility test is done before marriage, and those who are waiting could also continually test the AMH every 3 days. Thank you.